Hi, this is Miss Harmony, and this is Lupus Talk number 2. Today I'm going to be talking about lupus symptoms and the facts. First of all, what is lupus? Lupus is an autoimmune disease in which the body's immune system attacks its own tissues, causing pain, swelling, and tissue damage. This damage or these symptoms can be worsened by this person being in the sun. Some symptoms, early ones, include fatigue, joint pain, fever, and a lupus rash. And a lupus rash is a rash starting from under one eye, going across the bridge of your nose to the under the other eye, and it's sometimes called a malar rash, like a malar butterfly. Other symptoms vary from person to person, which can include hair loss, anemia, swelling, chest pain, sores in the mouth, nose, and Raynaud's condition, which causes the tips of your fingers to turn blue or purple when you get cold. And that's due to the cold and not having good circulation. Lupus is not contagious, but does have a hereditary component, which means it can be passed to someone in your family. Diagnosing lupus, you would have to go through a series of blood tests. Most important is an ANA test, which is an anti-nuclear antibody test. It is not just based off of your symptoms alone, because lupus is known as the great impersonator and can cause a lot of different issues and can be a lot of times misdiagnosed. There are 4 types of lupus. I'm going to start with the most mild form and progress from there. The first form of lupus I'm going to talk about is neonatal lupus, and this is in rare cases when a mother with lupus has a child. Certain symptoms can be passed to the child, such as the rash, anemia, liver problems, and very rare cases, heart problems, to the newborn child. But these symptoms only usually last maybe a couple of days. The second one is drug-induced lupus. Drug-induced lupus can be caused by certain medications, and the symptoms usually stop or should stop when the medication is stopped. The third type is discoid lupus, which only affects the skin, and is usually the malar rash across the top of the face, and also rashes anywhere on the body. 1 in 10 of people with discoid lupus progresses and develops SLE. SLE is the 4th type of lupus. Okay, I'm going to try to pronounce this. I've had it for 7 years, but I'm really going to try to pronounce it. Okay, it's systematic lupus erythemosis. Okay, you can look it up. That was my best pronunciation of it. I will caption it below. This form of lupus, SLE, is the form of lupus that I have. It is the most common form of lupus, and is considered more serious than the other forms. SLE can affect your kidneys, heart, skin, lungs, brain, blood. 45% of these patients experience pleurisy, which is the swelling of the sac around your lungs, or pericarditis, which is the swelling of the sac around your heart. In both cases, which I've had, so I'm like part of that unlucky 45%, but it does happen. Symptoms can flare and come back or go away at any time whenever it just feels like it. Also, there's a possibility of remission, and there's also a possibility of death in extreme cases. There is no cure for lupus. Some other facts is lupus mostly affects women of color. Men can also be affected on more rare cases, but when it does affect men, it is very aggressive. Symptoms can show up at any time after puberty. For me, it started, well, I was diagnosed when I was 16, but I think I was showing signs of it before then. I was also misdiagnosed before then. I was misdiagnosed with growing pains and mixed connective tissue disease. Untreated lupus depends on the symptoms that the person is showing. Like if you have mild non-life-threatening symptoms like fatigue, joint pain, and rash, it shouldn't get a lot worse than that, although those are things that you would want to treat. For other people with kidney, lung, or heart involvement, should get regular checkups to make sure that nothing life-threatening develops out of this. Because kidneys, when it affects your kidneys, you can have kidney disease, which leads to kidney failure, which unfortunately a lot of lupus patients suffer from. So every time I go to the doctor, they're always checking my kidneys. Lung function, which affects me, the pleurisy, cause restrictive lung disease along with my asthma. And heart problems, the pericarditis around your heart can squeeze or cause stress to your heart. I unfortunately experienced that also, but I've been fortunate enough that the disease hasn't affected the actual muscle of my heart, which can also happen, and which doctors are afraid of if you don't get regular checkups. Okay, I got a lot of information from www.lupus.org, and that is the official site of the Lupus Foundation of America. I got some information from WebMD. I also got some information from the Lupus Foundation of Minnesota. I'll be doing a separate video about lupus treatments and the side effects of medications used to treat lupus. I love questions. Feel free to ask me questions. If you do have lupus, there's a site called lupuscheck.com where you could go to and order a journal. It's a free journal that you can track your symptoms in. I ordered one and I'm waiting on it, so we'll see. Maybe I'll do a video about that. And like I said, ask questions. I'm going to put this video on YouTube, Miss Harmony 09. And I just want to thank everybody from the support I got from doing my first video, and I hope you continue watching and spread the word or the information. Thank you.